So
Around
we
like that.
intended to make this place for you so that you can walk easily. Wait, are you sure you want to?
You're the Dean of Academic, Clinical. What are you the Dean
Yes,
of?
you can just provost and dean of academics or academic dean. Dr. Dean of College of Applied Health Sciences.
I'm just referring to the head table.
I know. You're yeah.
Dr. Trinidad is the Dean of,
Student affairs.
I think she was saying the pictures, you can't use the All Saints logo.
That's the reason why I'm not wearing. Right?
And he's the head of, so A pleasant good afternoon to everyone present and to those viewing online. It is with great pleasure that I welcome each of you, the head table dignitaries, faculty and staff, white coat recipients, family, friends, invited guests, and the media to the Richmond Gabriel White Coat Ceremony. I'm Dr. Giselle Miller, Associate Professor, and I am honored to chair this afternoon's proceedings. Please join me in standing as we acknowledge the national anthem of St. Vincent and the Grenadines. Thank you very much. You may have your seats. Allow me at this time to introduce our head table. First and foremost, we'd want to acknowledge the president of the Richmond Gabriel University, who is unavoidably absent, Dr. Manny Paul Pillay. At our head table, we have Dr. Sanchoy Sangil, Provost and Dean of Academic Affairs, Dr. Gomati Chunilal, Dean of Student Affairs, Dr. Hughes Duggan, Director of Internal Affairs, Dr. Rohan Dishong, Urologist and Head of the Surgical Department, Milton Cater Memorial Hospital, and today our keynote speaker. I want to also acknowledge all faculty and staff, and at this time we invite Dr. Sangel to give us our official welcoming remarks.
Welcome, welcome, welcome.
Welcome not only to RGU, but also welcome to the exotic world of medicine. Let me take you through a time travel to welcome you to this exotic world. Way back in 1957, there was a surgeon. No, it was not me. Okay? I was not born then. He was working in Africa, and he saw a boy with a big swelling in his jaw. He had no clue what it was. He took a biopsy and he sent it. They said sarcoma. Nobody knew what was. The boy died. 1 week later, another child came with the same problem, same situation. He sent a paper to the British Journal of Surgery. They didn't even bother to reply. He sent messages to his many friends, which he had all over Africa. He was in Uganda. He sent it to South Africa, to Mozambique, he must have sent even to Nigeria, I don't know. And after 2 years of waiting, he got 40 replies from other surgeons working who said they have seen similar conditions. So he compiled all their data and he presented in the British Journal of Royal College. He was an Irish surgeon. He had only one eye, because somebody had thrown a ball at him and he had blown out his eye. There was a pathologist sitting in that group. His name was Tony Epstein, who took an interest. And this Tony Epstein, along with his colleague Yvonne Barr, they extracted something from that material. And they found that this tumor was not a sarcoma, it was caused by a virus, which came to be known as Epstein-Barr virus. Tony Epstein, Yvonne Barr. And who was this surgeon? This one-eyed Irish surgeon? He was Dennis Parsons Burkitt, Burkitt's lymphoma. So, in one story, we have three famous names. Burkitt's lymphoma, Tony Parsons Burkitt, Epstein-Barr virus, Tony Epstein and Yvonne Barr. So my purpose of telling you this story is that the world of medicine is very exotic. It's very demanding, but it's very fulfilling. There'll be a lot of tears. You will lose a hair or two. I can promise you, you won't lose an eye. You might lose a few pounds of weight, or you might gain a few pounds of weight. It all depends on you. But at the end of it, you will be much richer by the experience. So welcome to this exotic world of medicine. Welcome to RGU.
You might lose a few hairs or two. Well, women, at least, we can put in the braids that we can feel quite accomplished. The donning of the white coat signifies a remarkably important transition in the life of every medical student. By accepting these coats today, you officially step into the world of clinical medicine, the official beginning of your career in medicine. And to introduce our keynote speaker, I want to invite Dr. Hughes Duggan to do the honors.
Good afternoon to everybody. Last time, the dais was over on the right side, so I almost went to that side. But thank you very much and welcome. This is the first time I'm addressing the members of the student body since 2018, I think it was. And at that time, I gave the keynote address at the white coat ceremony. And at that time, I exhorted the members of the administration at then All Saints University, St. Vincent, to move to higher ground, okay? As the ground we were on was saturated physically and metaphorically, it was. So they did make a move to not a new beginning, but a sort of change in direction. And I was happy to see that change, because in order for us to survive and ultimately become one of the better schools of medicine in the Caribbean, we had to change direction. And I think a little over a year ago, we obtained a new charter as a beginning, from All Saints University School of Medicine to the Richmond Gabriel University School of Medicine. And that's a good beginning, and hopefully we'll continue to see the changes as they go on. I was asked by Dr. Chunilal, the Dean of Student Affairs, and I can say without hesitation that the heart and soul of Richmond Gabriel University. I've never seen anybody so dedicated and who works as hard, and she doesn't get the credit, or she is never usually acknowledged as such, but she is. She is the hardest worker in this organization.
I agree.
Thank you, sir. So when she asked me to find a keynote speaker, I asked her to give me a few days to think about it. And I thought about it, and I thought about it, and she said, I considered someone who could be an example to the present white coat recipients and to the ones in the future. And our keynote speaker today is somebody whom I've known all of my life. I guess that attests to how old I am. All right. But I've known him all his life, okay? He was nurtured from humble beginnings, okay? He attended the Boys Grammar School and then left St. Vincent on a scholarship to our alma mater in Mona, Jamaica, the University of the West Indies, where he graduated in approximately 20 years after I graduated with an MBBS degree, Master of Surgery, Master of Medicine, And from there on, he went on to Barbados, where he did his internship as a part of the UWI program, and also went on to start residency there, then transferred again to Mona, where he completed his residency, went to England, did his fellowship exams, became a fellow of the Royal College of Surgeons, and then he also, during that time in London, did a diploma, became a diplomate of the University College of London School of Urology. So he became a urologist while in England. But then he returned back again to Jamaica and obtained his Doctor of Medicine degree, which is given by the university for postgraduate work in urology. So when he completed that, he came home. And I chose Dr. Dishong, MBBS, FRCS, to be our keynote speaker, because to me he has demonstrated courage and a determination to be all that he could be. And I want you to use that as a mantra, to be all that you can be. You know, it's one thing to say that someone is a bright person, you know, but you don't know the numbers or the times that he spent burning the midnight oil. I'm going to quote a little bit of Henry Longfellow's words. I don't know, because it was drilled into me by my mother, and I'm sure by his mother and grandmother, you know, and I'm going to change it a little bit. And Henry Longfellow said, "The heights by great men I'm going to add, and women reached and kept were not attained by sudden flight, but they, while their companions slept, were toiling upwards through the night. I used it as my mantra as a youth. Learn those words, inwardly digest them. And that's what Dr. Deschamps epitomized. He returned to St. Vincent in the early 2021 and became our country's only urologist. And he was in that position for many, many years. He also became and is still present the head of the Department of Surgery. He has served this country well, and he has continued to do so at this time. I'll let you know on a little secret. Dr. Deschamps likes to talk. So listen up as I present to you our keynote speaker, Dr. Rohan Deschamps.
Thank you very much, Dr. Duggan. Good afternoon, everyone. In the absence of Dr. Paul, the Ministers of Health and Education, I wish to acknowledge the presence of the Provost and Dean, Dr. Sanyal. I wish to acknowledge also, as I affectionately call her Sandy, because she was my intern a few years ago, Dr. Chuninal. We should acknowledge the presence of Dr. Duggan and Drs. Miller and all the other dignitaries, invited guests, my juniors in the profession who have come to listen. As I actually look at you young people, I wish to thank you for being here, but also, in a way, I feel a heavy heart, because I wish I could have discouraged you before. I always wonder what kind of a personality it takes to be a doctor. I remember many years ago, that was about 1984, just before I won the only scholarship that this island offered, and I'm going to be exactly 20 minutes, I've done 2 minutes of it. I was walking along the roads of Kingston, and one of my teachers met me and said, Rohan, that's my first name, what do you want to do when you win this scholarship? And I said, if I win this scholarship, because they actually had more faith in me than I had in myself. And I said, well, I'm actually thinking of being a physicist or an engineer. And he said, haven't you thought of medicine? I said, yes, I have, but it's too long. Besides, I love math and machines. And he says, why not be a doctor? Because at least you can come back to St. Vincent. Medicine always been in the back of my mind. I always wanted to be a doctor. I spent my youthful days dissecting lizards. In those days, we'd catch them, we'd kill them, sacrifice them, and we'd open them. I actually spent my youthful days doing that. Today, I don't even want to touch a lizard. I thought about it, and a few weeks later, I was offered a scholarship, and I jetted off to Jamaica. I gave that story to let you know that, trust me, if you're going to be a doctor, as Dr. Duggan said, it's an act of perseverance. You have to have a little bit of a lot of things, but little bit of things, a lot of knowledge, a desire to learn, a lot of perseverance, and a sadistic personality. A personality that wants to inflict pain on yourself. Because medicine is not just for the so-called intelligent. We're not brighter than the others. You know what we have that the others don't have? Perseverance, that ability to stay at it and not give up. And that kind of sadistic personality where you can inflict pain on yourself, bear the pain, and smile. It sounds bad, but it's true. You know the amount of times as a doctor you will feel like, "Ugh!" You feel like swearing at a patient. Not all, but a particular patient who decides that he has to wind you up the wrong way. And many times in my clinics, I'd go into what I'd call the formal mode. When I'm in that mood, I'd say, Mr. John, you take this, you take that, etc., and that helps to calm me. Because you'll always find those patients. And that's why I say it takes that type of a personality, the ability to suffer long. So, why am I here today? To tell you 3 basic things. You're going to be doctors. I assume that you've done the first part, the preclinical bit. You've done the bits of anatomy and physiology, etc. So you're now all longing to get into the hospital, aren't you? You all want to do a lot of things. Do me a favor. Every day in my clinic, every day in my office, 1 or 2 patients comes into me. They come with an ultrasound, he used to tell you, or a CT scan, sometimes an MRI, sometimes a CT angiogram, and it says a diagnosis. The most common one is an ultrasound that says, oh, there's a lump in the kidney. And I turn to the patient and ask, who sent you? Normally they say, this doctor sent me. And sometimes they just come for a second opinion because the ultrasound says that, they had it by another doctor, and it says there is a cyst in the kidney, or there is a mass in the kidney, or there is hydronephrosis, or for men, the prostate is enlarged. And I asked them, what were you suffering from that this doctor sent you for the ultrasound? Oh, doc, I had belly pain. Where was the pain? It was right on the left side, right there. And the ultrasound says, a cyst in the left kidney. Or the usual thing, I see men every day with ultrasound that says an enlarged prostate. How old are you, sir? 65, doc. And you go through a strict history, and then you ask him, after all that history, so tell me, what about the urine? How many times at night you get up to pass urine? He says, doc, only once. Is it slow? No. Does it burn? No. Is there blood? No. So why are you here to see me? Because the doctor sent me and said I had a big prostate. We have reached the age where we now treat ultrasounds, CT MRIs, MPIs, that's multiparametric imaging, where we fuse 2 images together to get more information. We've used every test. We've used PSA antigen. We've used prostate-specific antigen and prostate-specific cancer test. We've used genetic tests to tell us that you have a cancer. We've done everything in the book. We have invaded every orifice. We've searched in every gene to try to find a diagnosis. And you know what we've forgotten in all of this? Who do you think we've forgotten? The patient. Because what have we not done? Many times we haven't even spoken to the patient as yet. So 10 minutes into my talk, I'm begging you, please talk to your patients. The single most important thing you will do is to talk to your patients. When I heard that 30-something years ago, I didn't believe it. Have you ever seen any exam question given to you, any OSCE, any MTQ given to you that gives you lab tests without giving you a clinical scenario? No. You know why? For every abnormal lab test you get, there are 20 different reasons why this patient can have the abnormal blood test. Classic scenario, underwater every day, hyperkalemia, as doctor would tell you, and a normal patient. And the first thing the intern wants to put up an IV access, give IV medication to bring the potassium down. And what's the first thing every experienced doctor does? repeat the potassium. Because the patient is sitting there, normal patient. I've had a gentleman walked into my office. Doc, doc, doc. I said, yes, sir. How come you never told me my kidneys are bad? I said, your kidneys aren't bad. I saw you 2 months ago. I see him every year. What do you mean my kidneys aren't bad? Well, I went to the lab and they said my creatinine is 400, which is equivalent in the American units to around 4.5. It's like 90 to 1. And I'm like, so in other words, he is like stage 4 chronic kidney disease, almost pre-dialysis. But he's a normal patient who walked into my office. I saw him 2 months ago with perfectly normal kidneys. And I asked him about his symptoms. He had no symptoms of chronic kidney disease. So, went on the bed, I examined him. Unfortunately, I have an ultrasound in my office, before which I did a dipstick, perfectly normal, no proteins in his urine, no blood, nothing to indicate any acute kidney injury. So I scanned him with my ultrasound, perfectly normal. So what did I do next? I picked up my phone, I called the lab. I said, can you do me a favor, please? Can you rerun that blood test? At the same time, I gave him a form. Go at the other lab and get another blood test done. The first blood test came back half an hour later. Oh, doc, we are sorry we made a mistake. It's actually 112, 112. The second lab called back 5 minutes later and said, oh, doc, the results for the creatinine is actually 113. Essentially identical blood tests. The moral of the story, we're not treating tests as important you might think they are. And you're going to North America, you're all going there, where you're going to see all the tests. You'll be inundated with tests, you will never believe it. But until you take the time to talk to your patient, you will still get your diagnosis wrong. The other thing you need to do is to touch your patient, examine him, do a physical. You know, in medicine, the only religious thing we do is laying on of hands. If you're Christian, you understand what that means. We lay hands on patients, not to heal them, no, so that they may be healed. Okay? We touch, we examine, we feel lumps and bumps, we elicit, we percuss, we listen, because we then put all that information together to get a diagnosis. And 70 to 80% of your diagnosis you will arrive at by just those two things. I just read the memoirs of a GP, or general practitioner, who practiced in the UK for 30 years. Knowledge and presence of the Minister of Health, my colleague and friend, Mr. Curtis King. Welcome. Sorry, Minister of Education. Jimmy Prince, sorry, is not here as yet. So, she recounts her 30 years as a general practitioner. She tells of the days when she went to her patients' houses, ranging from the late 70s when she graduated up to when she eventually retired. I read her memoirs, and it dawned on me, the only thing she had with her, along with her ears to listen, her stethoscope to listen, her hands to touch, was a urine dipstick and a glucose meter. And she made all her diagnoses using those simple things. Very rarely did she have to send a patient to the ER or admit a patient to what was in those days a cottage hospital. She gave a story where she was called to a very posh area in London to see a semi-retired politician who was groaning in pain. She asked him, she was expected him to have chest pain. She asked him, where is the pain, sir? She said, it's in the flank and it's going down towards my groin. She examined him and elicited costa vertebral angular tenderness, dipstick his urine, saw a trace of blood, treated him for renal colic. 2 days later, he called to thank her. Well, the day after she checked him in on him, he said he was feeling much better. 2 days later, he called to thank her. I passed my stone. What you will see in the hospital is the tip of the iceberg. You will see maybe less than 10% of the pathologies that exist in the community. And you will think that this is what medicine is. No, it isn't. Fortunately, most of medicine occurs outside of the hospital, in offices, in nurses' surgeries, in district clinics. You'd be surprised. I know you think that the hospital is where most of medicine occurs. No, it isn't. Because we have moved from, when I was trained, we were trained to be primary care physicians, family practitioners, or GPs in my day. We were trained, all 5 years of my training, we had 10 weeks every year, which is 1/5 of the year, in community medicine. We had rotations and exams in community medicine because we were told when you're finished, we want to send you out in the community to be a primary care physician, because the aim then was to prevent illness or treat it in the very early stages, not to become a hospitalist. I know most of you want to be neurologists. You want to be a cardiologist, a gastroenterologist, obstetrician, a gynecologist. You want to be an endocrinologist, a surgeon, maybe a urologist. You know what we need more than all of that? PCP, primary care physicians, especially family physicians. If we had 10 family physicians for every specialist that that graduated, medicine would be transformed. That's why medicine in the UK and medicine in the US is so different. You hear your colleagues in the US speaking about how long the waiting list in the UK is. But they have a fairly good system, because if you have a cancer, you shouldn't have to wait more than 6 weeks to see a specialist. And most cancers that are urgent is a system for fast tracking them to see the specialist even quicker. But it's a system that caters to everyone. Where you go in the US, you will see people accessing their doctors within a day or two. And that's ideal. Unfortunately, it's not ideal for everyone. So you will see the dichotomies. You will be faced with it. And at the end of the day, I hope you'll choose to remember that it's better to prevent it than to cure it. My hope, before I finish in the next minute or two, is that many of you young people who are so starry-eyed, okay, will touch the ground and come to reality fairly soon. Every group of medical students who've passed through me, I've always encouraged them, especially my Nigerian colleagues and Ghanaians. Those are the two most common African countries that pass through my department and me. The Ghanaians, mainly Nigerians. I've always asked, one of you should go back. But they said, but doc, it's so hard. Do you know that it's easier to become a millionaire in Nigeria than in the US? Do you know that? I don't think you realize that, right? I know. That's because you're starry-eyed. Welcome to medicine again. If you want to know how, after this session, we're outside, okay? We'll talk about it. But do not forget what I've just said. It's not about the money. I know a lot of you are going to the US because you see the flashing lights, you hear things are great, you've heard that the grass is greener. I always tease my medical students and tell them, I know you're going to heaven. I tease them. I know you're going where the grass is greener. I thought that too. I actually worked in the UK. I worked in Barbados. I worked in Jamaica. And I asked myself, out of all 3 countries, where were you as a resident paid most? made the most money. It wasn't Barbados. Their GDP is higher than Jamaica's, and their currency is almost on par with the UK. It wasn't the UK, whose currency is 3 times ours, and whose motorways are long and smooth, and I can drive for 200 miles at 80 miles an hour non-stop. No, it wasn't the UK. It was actually Jamaica with the lowest currency. It wasn't about money either. Interestingly, because I just loved medicine. After I started and I was inducted after a few years, you eventually get inducted. You eventually wake up to realize this is like a marriage. I cannot get divorced now, it's too late. I've already lost everything to medicine. At that time, I lost everything virtually. So I eventually gave up and gave in to medicine. So I traveled the world, picking up experience, getting degrees, getting information. And it was Jamaica. You know that island up north where everyone in Britain told me, all my friends said, do not go back. Don't go to Jamaica. They'll shoot you. That's what they told me. You won't leave alive. It was in that island I got the most experience. And surprisingly, in that little island, I made the most money. So do not judge a book by its cover. My hope for you, all of you Nigerians and Ghanaians and Africans, is that when you are finished, just one out of, I heard 11, would go back to Africa. I've had colleagues who've done that, and a few of them still hail me. A couple have gone back to Ghana. I had a very close friend of mine. He's now Professor Alopa. He's at the University of Ibadan in Nigeria. He's a professor of surgery and urology. We knew him as Bumi. Bumi was 1 year my senior in urology in the UK. And I remember when he told me he's going back. I just finished my fellowship. He finished his the year before. He told me he was going back to Nigeria. I was actually surprised. And he told me why. Because he told me he was going to pick up a research job, and now Bumi is a professor of surgery and urology, University of Ibadan, Nigeria. There is hope. Thank you very much for listening to me. All the best in your future endeavors.
Shall we have a moment of silence for the sacrificial lizards? Thank you, Dr. Dishong, for those words of wisdom. And you are reminded that medicine is not all about the glitz and glam, but it's an act of preservation. You must have the desire to learn. It's a sadistic personality. You're encouraged to talk to your patients, to touch them in the right way. And it is not about the money, but it's about the love and care that we have for our patients. Thanks again for those words. So we are now at the point that we are all gathered here, the white coat presentation. But before we get into that, I want to acknowledge the Minister of Education, Mr. Honorable Curtis King. And I'm going to ask you at this time just to give some brief remarks. Thank you so kindly.
Thank you very much, Dr. Miller. And I promise you I will not be long. After all, I'm late, so I can't hold up your show any longer. But please forgive me. This morning, well, today has been a long day. As you know, school commences tomorrow. So I had to go to church to seek God's guidance and blessings for a challenging year ahead of me. And then one of our educators, very popular guy, died suddenly. And he lived in the northeastern part of the country, so I had to be there to show my support and solidarity with the grieving family. So I now travel from there to my third activity for the day. And I still have one more to go. But with God's grace, I'm going to get through. I want to thank you for inviting me. I know your predecessors, they had their activities, and I attended one at least. So this is your very first one, and I'm very happy to be here. I want to welcome the students, and especially those of you who are the special guests this evening as part of the white coat ceremony. You're receiving your white coats. As I have said to other students, you are in fact making a very important and bold step in the development of your medical career. The fact that you get to this stage indicates that you are committed and that you are determined to ensure that one day you will join my friend, and I'm happy that I reached just the latter part of it. I'm a bit older than him, but we were schoolmates, Dr. Deshawn. Yes, that one day you will be able to join the medical profession just like he did. And therefore I want to congratulate you on making such an important decision. More than that, I want also to congratulate you to making the choice that you have made in terms of coming to St. Vincent and the Grenadines to attend this medical college, this university. It's very important because what you are actually doing, you're moving from, if you like, your comfort zone into a new environment where I am sure that in addition to your medical training, you're going to be exposed to a culture that is different. And you can only improve by being exposed. And in a sense, you will be making your contribution to the ever important cooperation among people, among all humans. Because after all is said and done, we have to live together. And the only way we are going to live together is if we have an appreciation for each other and each other's culture. So I want to welcome you and to say to you that this is a country of warmth and friendly persons. And of course, while you're here, as I indicated earlier, it is important that you get to sample some of the different activities and lifestyle in this country. I know quite a number of you are from West Africa, and we, as you will discover, if you have not yet done so, quite a large number of the descendants of the people who came from West Africa are still the ones dominating in terms of population number here in St. Vincent and the Grenadines, so that you should not find any difficulty in fitting in. I hope that for the rest of your ceremony, that you will be very happy and elated, and that at the end of the day, you will leave here feeling a sense of achievement. But don't get carried away. You have just begun. So thank you very much for having me, and I wish you all the best for the rest of the program.
Thank you very much, Minister. And I believe some of the students sampled the carnival recently. Yes? I would not give away the secrets that I know. All right, so we are now at the white coat presentation. I want to invite Drs. Chunilal, Duggan, and Dr. Sanyel to assist with this aspect of the ceremony, following which Dr. Sanyel will also do the reciting of the Physician's Pledge, and he will acknowledge the Dean's List certificates as well.
people sitting on this dais, all of us share one common bad habit. We all like to talk. But we must not forget that this evening is for you. It's all about you. And it starts now. The first one will be the white coat presentation. As I call out the names one by one from that end, it'll go like that in a serpentine fashion. You will come, smile at the camera, and do all the necessary things, and then you will go back to your chair. And after that, we'll have the physician's pledge. Okay, so without further ado, Yvette Amigatse. Ifunanya Chinwaba. Uchenna Ike. Anusha Jayavira. Precious Levy. For those of you who don't know, he's really precious. Samuel Michaels. Latif Olawale. David Olwatimiliin. Christian Orji. Vansh Patel. Sotonie Potts Johnson. Okay. So now we have the Physician's Pledge. All of you, all the white coat recipients, please rise. Raise your right hand and repeat after me. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patients will be my first consideration. I will respect the autonomy and the dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. Congratulations. Okay, you may take your seat. We have a student who's on the dean's list for certificate, but I think the student is still traveling, so she has not been able to make it. But I can promise you, she really deserves to be on the Dean's list. Her name is Morolake Joseph. So give her a good hand.
Okay, so we are now at the end of our ceremony. You had a great time? Yes? Okay, short and sweet, to the point? Yes? So we want to say special thanks right now to the members of the head table, to Dr. Deschamps for your keynote speech. Thank you very much. ITFX Media for the live stream, our photographers, thank you kindly, faculty, staff members, and everyone present. Thank you for making this afternoon's white coat ceremony a success. And you are now welcome to take photos and to enjoy the Dean's cocktail. So have a pleasant and lovely evening. Thank you. So the white coat recipients, you will gather here first for some photos.
Picture session.
Right, they're coming.
All the students who have their white coats, don't leave. We want to do some group photos.
Olivia, are you here? Olivia, are you here? Yeah, because Morolake is not here, so she has to keep it carefully to give it to her. You'll put it in your car? I've already put my signature there.
The angle not wide enough for me.
Everybody big smiles?
Now that you know that I'm ready, you don't have to look so scared.
Yes, smile.